But at this point, do you agree that we have to adjust the protocols and the quarantine status of, LGUs, no? Uh,
Well, for me, it's not because of the number of cases, kasi nga it can spike anytime. But the entry of the Delta variant is really something to keep us on alert.
prepare for.
Um, yes, because it's more transmissible. Yung alpha and beta is 60% transmissible. Ibig sabihin, if you have a 2.4 reproduction rate, magiging around 3 to 4 or up to
Yes,
5
yes. Yeah.
cases for one positive case. But in the case of the Delta variant, it's 97% reproduction number. So it's around 6 to 8 people that will be infected with one positive case. So sobrang taas yung jump if ever. Like today, if there's only 3 people that has the Delta, or sabihin na natin 11 people, because that was the report today, in a matter of 1 week, magiging thousands of people na yan. Ganong kabilis yung reproduction niya. So I think that's what's we have to worry about, the reproduction
Right.
number and the increase in spike of cases. And that's what also we are preparing for at the Philippine Red Cross, the surge in the cases that can happen at the blink of an eye. Parang today we're at 4,000 to 5,000 cases per day. Tomorrow it can immediately to 10,000 to 15,000. When we had 15,000 in April, we were really parang scrambling where to refer our patients, even at the Red Cross, because we receive calls. We have a fleet of ambulances. So we really find hospitals for these patients. And in April, we have to send them to Batangas, to Tarlac, to Pampanga, because the Metro
Right.
Manila hospitals were already full.
I guess that's everyone's question. No? Unahan na ba natin or antayin natin na biglang tumaas? Diba? Because that's what you
I
just said,
think
no? Na
it's
in a matter of a week. Sa Indonesia, nag-double. Diba? So,
yes, it's better to be prepared and to parang move ahead, ano? Because we believe that um, we should be like really putting things in place so that we don't get the situation of India or Indonesia.
And Dr. Ubial, that's what I wanted to ask. In terms of preparing for another surge and preparing for the worst, what has changed, both in terms of numbers, capacity-wise, and also in terms of systems at the hospital level, at the LGU level, or even at the level of communications? What has changed from the last surge in April to now that can make people feel that when we say that we're preparing, something has actually already changed?
Yes, I think the DOH has mentioned this, and in my personal experience with the Department of Health, we have more isolation facilities. In fact, the Red Cross has established 416 beds only starting last April, and I think most of the local governments have also increased their isolation capacities because of the surge last April, and we have maintained that. So kahit na bumaba na nung May, nandiyan pa rin yung mga facilities, ano? And then for the Red Cross, we have emergency field hospitals, yung mga tents na immediately madedeploy namin to expand the hospitals. And I think the DOH has built some of their modular facilities like the Quezon Institute. They're building one in Lung Center, and I think Manila has a 360 bed in Rizal Park, which was not there last April, no? And I know there are more ICU beds in the Department of Health. They've brought in ventilators, X-ray machines, and they distributed a lot of ambulances and um, vehicles for people to use if there is a need for patient transport or even cadaver transport and all those. So, yung sinasabi ng DOH that we're better prepared now, I think that's true because we know that they have additional facilities for that. But whether we are ready for surge like Indonesia per day to 40,000 per day, let's say we have 6,000 today and tomorrow we'll have 12,000. I don't know if we can actually address that. If we have a gradual increase like 6,000 today, 7,000 tomorrow, 8,000 the next day, then maybe our systems are okay with that. But yung biglaang surge, I don't know if we can really address that. That's what we're afraid of. And I think what happened in India and Indonesia is that they really had this super spreader effects, yung mga religious gatherings that really caused a lot of transmission. So I hope that we really stop those events. Yung mga nangyari last April, there were pool parties, there were birthday parties and gatherings, ano? So should come out with those messages na yung super spreader events must really be halted.